Hello everyone. I am Bhuneshwari Rane from KYDS City College of Pharmacy, Sakegaon. Today I am here to discuss about sympathomimetic drugs. On successful delivery of this topic, you will be able to understand sympathomimetic drugs, classification of sympathomimetic drugs, mechanism action of sympathomimetic drugs, its clinical indication and side effect of sympathomimetic drugs. Sympathomimetic drugs are also known as adrenergic drugs or adrenergic amine. Adrenergic drugs or sympathomimetic drugs are the substances that modify the action of endogenous agonist of the sympathetic nervous system. The primary endogenous agonist of the sympathetic nervous system are catecholamines, that is epinephrine, that is also known as adrenaline, norepinephrine, that is also known as noradrenaline, and dopamine. Now we have to discuss about classification of sympathomimetic drugs or adrenergic drugs. These are classified into three classes as direct acting sympathomimetic, indirect acting sympathomimetic, and mixed acting sympathomimetic. So first we have to discuss direct acting sympathomimetic. Direct agonist directly activate adrenergic receptor. They bind to and activate alpha 1, alpha 2, beta 1 and beta 2 receptor. Naturally occurring molecules which bind to this receptor include norepinephrine, epinephrine and dopamine. Next we have to see indirect acting sympathomimetic. Indirect agonists enhance the action of endogenous catecholamines. For example, amphetamine, hydroxyamphetamine. Then next is mixed acting sympathomimetic. Its name indicates its meaning, that is, mixed acting drugs employ both mechanism, direct and indirect. These drugs act both directly with the receptor site and partly by the release of endogenous norepinephrine. These agents have no hydroxyl group on the aromatic ring but do have beta hydroxyl group. For example, ephedrine, phenylpropanol Now it's time to reflect and think how mechanism action of adrenergic receptor takes place by releasing or by reuptake. Pause the video, think and write down your answer in the notebook. Once you have done your answer, then you start the video. Yes, right. Mechanism action of sympathomimetic drugs or adrenergic receptor takes place by four ways. Direct receptor binding, promotion of norepinephrine release, inhibition of norepinephrine reuptake, inhibition of norepinephrine inactivation. Let us see one by one. First, we have to discuss direct receptor binding. In this mechanism, drugs activate peripheral adrenergic receptor. For example, epinephrine, norepinephrine, and dopamine. Second, promotion of norepinephrine release. In this mechanism, drug acting on terminals of sympathetic nerves to cause norepinephrine release. Drugs can bring about activation of adrenergic receptor. For example, amphetamine, ephedrine. Then third one, inhibition of norepinephrine reuptake. Reuptake of norepinephrine into terminals of sympathetic nerves is the major mechanism by which adrenergic transmission is terminated. By blocking norepinephrine reuptake, drugs can cause norepinephrine to accumulate within the synaptic gap and can thereby increase receptor activation. For example, cocaine. Last one is inhibition of norepinephrine inactivation. Some of norepinephrine in terminals of adrenergic neuron is subject to inactivation by monoamino oxidase. Hence, drugs that inhibit monoamine oxidase can increase the amount of norepinephrine available for release, can cause thereby enhanced receptor activation. This is the simple and easy mechanism action of adrenergic receptor. Then we have to discuss clinical indication. Clinical indication of these drugs are asthma, heart failure, shock, anaphylaxis. Then side effects of these drugs are hypertension, sinus tachycardia, skeletal muscle tremor. Hope you have to understand sympathomimetic drugs. Thank you for listening.